Welcome to the Informed Woman magazine, where science meets clarity and knowledge becomes strength. I'm William Bologna. Let's make women's health understandable together.
Sometimes, when nature needs a little help, science steps in. This is the story of how in vitro fertilization and the innovations that followed have reshaped what's possible for millions around the world. IVF, in vitro fertilization, is an assisted reproductive technology that brings egg and sperm together outside the body. Through a series of carefully timed steps, life is given a new opportunity to begin. The IVF journey begins with ovarian stimulation. Fertility medications, often containing follicle-stimulating hormone, encourage the ovaries to produce multiple eggs instead of just one. Frequent ultrasounds and blood tests help ensure that the timing for egg retrieval is precise. When the eggs are ready, a brief procedure called egg retrieval is performed under light sedation. A fine needle is guided through the vaginal wall to gently collect the eggs from the ovarian follicles. Each egg represents a possibility, a single spark of life waiting for connection. At the same time, a sperm sample from the partner or a donor is processed and concentrated to select the healthiest, most active sperm, improving the chances of successful fertilization. In the laboratory, the retrieved eggs are combined with sperm for natural fertilization, or a single sperm is injected directly into an egg through a procedure called ICSI. This technique allows fertilization even when sperm count or motility is low. Fertilized eggs are cultured in an incubator, where they begin to divide and form embryos. Over several days, embryologists monitor their growth, selecting the healthiest for transfer or freezing. After development, one or more embryos are transferred into the uterus using a delicate catheter. Any remaining viable embryos can be cryopreserved for future use, allowing additional chances for conception. Then comes the waiting. 2 weeks of patience, hope, and courage, ending with a single test that reveals whether life has taken hold. To enhance success rates, some embryos undergo Preimplantation Genetic Testing, or PGT. This process screens embryos for chromosomal abnormalities and genetic disorders before implantation, reducing miscarriage risk and improving pregnancy outcomes. A newer advancement, Polygenic Embryo Screening, looks beyond single-gene conditions to assess risks for complex adult diseases, such as heart disease, diabetes, and certain cancers. Though still evolving, it represents a significant step toward personalized reproductive medicine. In recent years, Frozen Embryo Transfer, or FET, has revolutionized IVF. Rather than transferring embryos immediately, they are vitrified, or flash-frozen, and transferred during a later, more natural cycle. This separation allows the body to recover from stimulation and prepares the uterus for optimal implantation. Studies show that frozen transfers result in higher implantation and pregnancy rates than fresh transfers. By restoring the body's hormonal balance, the uterine lining becomes more receptive to new life. Vitrification prevents ice crystals from damaging cellular structure, increasing embryo survival and minimizing the risk of ovarian hyperstimulation. It's a scientific breakthrough that combines precision with safety. Frozen embryo transfer has also encouraged safer single embryo transfers. By controlling timing and quality, fertility specialists can reduce multiple births while maintaining high success rates. It's a gentler, more precise way forward. We began with causes, moved through diagnosis, and arrived at creation itself. IVF and advanced fertility treatments are not just about science. They are about perseverance, compassion, and hope. For those who have struggled, this technology proves that the impossible can become possible. And though this series ends here, the story of life continues.
Thanks for watching another video by the Informed Woman magazine. Please feel free to comment and ask questions. Subscribe for more science-driven medical insights.